traditionally with aneurysms or other aortic pathology that encompasses zone 2 of the arch, we would typically go to either not revascularizing the subclavian, potentially increasing the risks of neurologic consequences, or the other option was to perform surgical extra-anatomic revascularization. Neither one of these options is completely ideal in certain clinical scenarios. And now we have an option to be able to provide a revascularization of the LSA at the same time we're deploying the thoracic endograft, and do it in a much less invasive way. Because this device has a side branch that goes into the left subclavian artery, for anatomically appropriate patients, this would be a single stage treatment.
Before the Gore tag thoracic branch endoprosthesis, there are a number of ways to revascularize the subclavian artery. In the early days of endografting, it was found that revascularization was very important. There were more complications if you did not revascularize. Consequently, a lot of techniques were developed to try and revascularize, some of them surgical, but many of them endovascular. These techniques, however, were highly variable. With the Gore thoracic endoprosthesis, this branch device now allows us, in a verifiable way, to do something that's reproducible and has benefits for patients. With the Gore thoracic tag endoprosthesis, there are a number of ways that surgeons can benefit. But the most important thing is patients benefit. Number one, the recovery is much easier. The risks of procedures of surgical vascularization are removed. Patients get out of the hospital earlier and really have a much more reliable and quality result. For the surgeons, they don't have to worry about a surgical revascularization because the branch device will allow them to provide flow to the left subclavian artery. With that surgical procedure, there's always a risk of thoracic duct injury, of a laryngeal nerve injury, and that's removed with this new device. So there are benefits not only for the patient, but for the surgeon. The one-year results of the Gore tag thoracic branch endoprosthesis were recently published in the Journal of Vascular Surgery. They documented results that showed no evidence of aneurysm rupture, no lesion-related mortality, or no new renal failure.
Our results in the clinical trial really demonstrate very low rates of neurologic morbidity. In particular, the risks of stroke, the risks of paraplegia or spinal cord ischemia are quite low. In fact, for zone 2 TEVAR, these rates are quite acceptable and similar to what they were with other devices in zone 2, where either extra anatomic revascularization was not used or was used as an adjunct. And in this setting, what we are now able to do with the Gore TBE device is really provide the ability to revascularize the left subclavian artery at the same time as zone 2 TEVAR. So the risks associated with the thoracic branch endoprosthesis are quite comparable to the conventional treatments that currently exist. So in particular, the neurologic risks are quite similar. The risk of new dissection is quite similar based on data from our current clinical trial, as well as looking back to other FDA-sponsored clinical trials. The rates of renal failure and other rates, such as major bleeding risks, those are all quite low as well and very comparable to what currently exists. So I think overall the safety is there for this particular device. The efficacy is also there. And now we're able to do everything with a much less invasive approach, which is what patients want. So this is a new treatment paradigm for zone 2 arch repair. And so while it requires a little bit different mindset in terms of how one would go about planning for the case, really the steps should be familiar to anybody that does complex endovascular work. And the training involved is there, but well within the grasp of most practicing endovascular specialists. The ability to do this particular device, use this in the right setting, is, I think, relatively straightforward, and patients would do quite well with this much less invasive approach to treatment in zone 2 arch aortic disease.
It builds upon the legacy of the other Gore thoracic devices. I've been involved in the Gore TAG thoracic branch endoprosthesis since its inception. A lot of people worked together to make this device what it is now. We started with our first feasibility trial in 2014. Recently, we approved FDA approval in May of 2022. It's been a long road, but something at the end is a very successful initiative.